Good evening, I'm Jen Maxfield. Adam and Gilma are off. Tonight we've hit a sobering milestone in the war against coronavirus. After weeks of drastic increases, the U.S. now has the most cases and the most deaths around the world. The toll now stands at more than 20,000 Americans dead, surpassing Italy, and more than 500,000 Americans have been diagnosed. And today, a stunning and contentious decision by Mayor Bill de Blasio. He said all New York City schools will remain closed for the school year. But Governor Cuomo overruled that decision, calling it de Blasio's opinion and saying no decision has been made. Well, here's where the numbers stand tonight. More than 180,000 New Yorkers have been diagnosed with COVID-19 and more than 8,600 have died. New Jersey has more than 58,000 cases and more than 2,000 deaths, and Connecticut more than 11,000 cases and 494 deaths. But there is some hope. Governor Cuomo believes new hospitalizations have plateaued. Now, we do have complete coverage starting tonight with News 4's John Chandler. He's live at the newest field hospital opening in Manhattan today. John.
That's right, Jen. Behind me, Columbia University has turned its athletics facility complex, and most notably the bubble, into a field hospital. It really is an incredible feat coming together in just about a week. That is one major topic of the day. Of course, classes online here at Columbia, and New York City public school classes closing for the rest of the year. That is something people were even talking about up here, or at least that's what the mayor says. New York City schools will stay closed, definitely, says Mayor de Blasio.
The New York City public schools will remain closed.
Possibly, answers Governor Cuomo.
There's been no decision on schools.
At Columbia University, classrooms are closed, and the soccer field will now open as a field hospital. An oxygen farm pipes directly to bedside, crucial for the 288 COVID patients it will be able to house.
This is a beautiful facility. This is probably nicer than anything I've ever deployed in. And so we are able to take this and run with it and do great patient care.
Colonel Melissa Givens is a military doctor used to field triage overseas. She had recently retired, but felt compelled to rally other military medics to staff this hospital.
You just put out the call that there's Americans that need help, and it was an instantaneous response. They want to help and serve their community.
The field transformed to hospital in under a week. Dr. Laureen Hill has worked in mass casualty situations and knew New York Presbyterian's taxed ICU needs this space for relief.
This whole response and what it's required of all of us in New York and elsewhere, the ability to adapt and innovate is incredible, and it's completely manifest right here.
Governor Cuomo says hospitalizations have plateaued from the apex, but coronavirus remains deadly, taking the lives of nearly 800 New Yorkers in one day.
You can see that the number is somewhat stabilizing, but it is stabilizing at an horrific rate.
It's why New York officials are wary of reopening too soon.
As we enter this new phase of reopen, when do we do it? How do we do it? This person's opinion is here, this person's opinion is here. The best thing we have done to date is we have kept politics out of the discussion.
Well, this field hospital set up behind me, and of course the situation with the schools, another sign that there's still a ways to go in this coronavirus fight. Two more notes from Mayor de Blasio today on the subject of schools. Internet-enabled iPads will be distributed to students who need them by the end of April, and they are looking to put 6,000 homeless into hotels by April 20th. We're live outside Columbia University. I'm John Chandler, News 4 New York.
So important to support everyone, John. Thank you. Now, there are also some encouraging signs in New Jersey, where Governor Phil Murphy believes that social distancing efforts may be flattening the curve. But cases keep rising, so he is calling for stricter guidelines. Starting tonight, everyone riding New Jersey Transit must wear some type of face covering. News 4's Adam Harding breaks down the other changes Murphy's ordering.
Tonight, New Jersey is announcing sweeping changes to curb the spread of the coronavirus, and it starts with public transportation.
Today, I am signing an executive order directing NJ Transit and all private carriers to cut the capacity on all trains, buses, light rail vehicles, and para-transit vehicles to 50% of their maximum.
Bus and train companies must provide workers with proper equipment, and the order extends to riders too.
The order also requires all riders to wear a face covering when traveling either on NJ Transit or with a private carrier.
Anyone picking up takeout at a local restaurant is also now required to wear a mask.
As predicted, we expect the next 2 to 3 weeks to be especially stressful and difficult for our hospitals and our long-term care facilities.
Health officials expect to see a rise in the number of patients at field hospitals by day's end. The Secaucus site could see 50 patients, up from 20 yesterday, as the Edison Field Hospital prepares to open today. And officials now confirm USNS Comfort will be taking in some patients from New Jersey.
We have to keep doing everything we can over here to flatten the curve and get out ahead of this virus and stay ahead of it.
I'm Adam Harding, News 4 New York.
On Long Island, first responders received a generous donation of personal protective equipment. The Stephen Siller Tunnel to Towers Foundation donated 10,000 KN95 masks to those on the front lines of the pandemic in Suffolk County. The virus has now claimed 458 lives in the county and has infected more than 20,000. In Nassau County, the death toll stands at 792 with more than 22,000 cases. Both county executives spoke today about whether they plan to keep schools closed like New York City.
I would think that we will likely see an extension of where we are now. Whether schools should remain closed for the entire year, that remains to be seen. I don't think we can say that yet.
This has to be done in a regional manner. It has to be done in a methodical manner. It has to be based on the data.
Both county executives say they support Governor Cuomo's regional approach for reopening schools. But that approach has put the governor and the mayor at odds, triggering a battle over who does have control over New York City schools. News 4's government affairs reporter Melissa Russo breaks down the power play and who's in charge.
Advisors to Mayor Bill de Blasio say they gave Governor Andrew Cuomo a heads up before making the announcement.
That the New York City public schools will remain closed for the remainder of this school year.
They say they never saw the controversy coming.
The worst mistake we could make is to take our foot off the gas.
But in a flash, Governor Andrew Cuomo slammed the brakes on de Blasio's decision.
There has been no decision. That's the mayor's opinion. I value it. It is my legal authority in this situation.
Just the latest example of the governor schooling the mayor on who's in charge, and the mixed messages left parents feeling frustrated.
I'm disappointed to have them at odds with each other when they need to be working in concert.
Aides to Cuomo say the mayor's office called them just 5 minutes before dropping the news to say he hoped to discuss it with the governor. Mayor de Blasio says it's inevitable that schools won't be able to reopen and that parents and teachers have been pushing for a decision soon. But the governor insists the school calendar needs to be coordinated regionally.
Well, that's his opinion, but he didn't close them and he can't open them.
The governor may be right that it's not Mayor de Blasio's call, but it's been the mayor who's been shouldering most of the blame for being too slow to close the schools last month. So this time he might be trying to appear like he's ahead of the curve. The governor's reaction was very similar to how he responded when the mayor brought up the idea of sheltering in place last month.
New Yorkers should be prepared right now for the possibility of a shelter in place.
I'm not in favor of imprisoning people.
Yet while Andrew Cuomo seemed to revel in putting the mayor in his place, he ultimately did what de Blasio suggested, albeit a few days later, a point the mayor's spokeswoman made in a tweet today, saying, quote, "We were right then and we are right now." While the school calendar may be up in the air, more bickering between these two politicians could be a constant in these uncertain times. Melissa Russo, News 4, New York.
We have just learned that the COVID case numbers in Connecticut shot up to more than 11,500. That's up 972 from yesterday, and the state is reporting 494 new deaths. Healthcare workers are bracing for a possible patient surge. The National Guard is working to transform the Connecticut Convention Center into a recovery center. It will hold at least 646 beds and should be ready in the next couple of days. The facility will be for patients who are getting better but do still need medical care.